So we're going to be talking about the leadership imperative to achieve and sustain a healthier Washington. And it's true that a healthier Washington requires leadership and collective action, much like the type many of you in this room are demonstrating. And as we look to the next several years of health systems transformation, we must spread what's working and perform on our goals. So what is our leadership role in achieving and sustaining a healthier Washington? I'd like to invite one such leader to the stage now, Dr. Jay Fahti, who serves as the president and CEO of Coordinated Care, which is a managed care company which began serving members in Washington State in 2012 as a subsidiary of Centene. Dr. Jay Fahti is a board-certified physician by the American Board of Family Medicine and a demonstrated leader in providing innovative care for the underserved and uninsured in Washington. After earning a medical degree from UW School of Medicine, Dr. Fahti spent 20 years practicing as a physician serving the needs of patients in Washington. His career and professional engagements have led him to his role now, overseeing one of 5 Medicaid managed care plans. Dr. Fahti, thank you for being willing to come to the stage now. And Dr. Jay Fahti will be introducing our featured speaker in just a moment. Thank you.
Nathan, thank you very, very much. And good afternoon, everyone. It is great to see so many leaders and movers and shakers and friends from the healthcare community here today. When I was driving up, I thought, I wonder who I'm not going to know. I think a lot of us know each other. It's great to see you all here. If you're sitting in this room today, you obviously have a deep passion for healthcare in Washington State and serving our community. You're working tirelessly, serving your patients, clients, consumers, and members. You have innovative, out-of-the-box approaches to improving our systems and affecting real, sustainable change, or all of the above. If you will, let me go back briefly to the mid to early 1990s, when I was a medical student at the University of Washington, followed by being a resident family physician in Seattle, to make 2 points. First, I don't remember where I was exactly, but I do recall one day actually consciously coming to the realization that I had never, ever really thought about how doctors, hospitals, and other healthcare professionals got paid. And I remember coming to the realization that it was really kind of odd that the payments were based nearly solely on services. Office visits, procedures, tests done, keeping the beds in the hospital full of patients. And the more of these things that patients got done to them, the more revenue came into the healthcare system. I actually remember thinking there is essentially zero financial incentive to do a good job in taking care of patients. I also recall once hearing someone say back then, you know, considering our system pays healthcare providers on a transactional basis, meaning show us you saw a patient, did a test, etc., and we'll send you a check, with no incentives or payments around actually taking good care of people, it's a wonder health outcomes aren't worse. Now, allow me to take you just a few years along, for my point number 2, to working at a community health center or a community clinic in North Seattle in the late 1990s, where I worked for 12 years. The vast majority of patients at these clinics have either no insurance or they have Medicaid. And let me add a plug here, because we here in Washington have one of the best and strongest and most robust community healthcare systems in the country. And we should all be very, very proud of it. But I remember realizing very quickly that a lot of my patients had issues around mental health or substance use disorders. And it's very obvious to a provider that those two things are very frequently connected, and that they almost invariably interplay with each other, and also with people's medical conditions, whether it's heart problems or diabetes, the list goes on. And I remember everyone on the teams at my clinic did the very best they could caring for these patients. But sometimes we absolutely needed the expertise of behavioral health specialists, therapists and counselors of many kinds, psychologists, psychiatrists at times. And I remember asking our referral coordinator, Roxanne, about how to get my patients this needed care. And I knew it was out there in the community. And I remember hearing 3 letters that I had never really heard before. And the letters were R, S, and N. And I said, what is that? And I didn't learn about that in medical school. I think we all know that that term has evolved over time to VHO. I didn't know what access to care standards were as a provider back then, nor was I ever really instructed on this criteria. But I will say that at times with the system, it seemed almost a little bit more difficult to get my patients the behavioral health care they needed than it was for them to see a physical therapist or a cardiologist. So let's fast forward to the present day. I have had the wonderful privilege now, as Nathan mentioned, to serve as the president and CEO of Coordinated Care of Washington since May of 2012, where we are contracted with the state of Washington to serve over 200,000 Medicaid recipients as their health plan, which includes all of the 22,000 foster children in our state. We've also had the privilege of being a qualified health plan on the Washington State Health Benefit Exchange since its inception in 2014. On the exchange, we've been able to offer the lowest priced, most affordable plan in nearly every county we serve, and are currently the second largest plan on the exchange with over 30,000 members. I have the privilege of getting to tell my staff and teams every day, your job is to help some of the most vulnerable citizens in our state navigate the healthcare system, and often more than the healthcare system, and to be their guardian angels, essentially. And we get to work daily with so many dedicated, innovative, and patient-centered minds at agencies like the Healthcare Authority, Children's Administration and DSHS, the Governor's Office, the Office of the Insurance Commissioner, the legislature, the list goes on. And many of you, we are all working together to make all this groundbreaking, disruptive, yet necessary change that we're here discussing today actually happen. And as our state is now in the process of securing the 1115 waiver, Washington has signaled to the national landscape and to our federal partners our collective readiness to continue necessary health system transformation. I think we all know that this 5-year demonstration allows us to build upon the foundational elements of Healthier Washington and better serve the more vulnerable members of our communities through targeted, innovative initiatives and added Medicaid benefits. To get back to those 2 examples I just mentioned, my firsthand experiences as a new physician, first navigating the challenges of maintaining and coordinating the behavioral health care services my patients needed. I have seen my patients get excellent care from behavioral health providers across our state. And additionally, over the last 4.5 years, I've met the leadership and spent time with nearly every behavioral health organization in Washington. And I can confidently say that they are tireless, skilled advocates for our communities with years of expertise and dedication, which I would say is unparalleled. And I think now, well into the 21st century, it is evident that we all need to come together to create new and better systems focused on integrated, whole person healthcare delivery, which is without question in the best interest of the patient. And on the payment side, my early observations around the oddities of the reimbursement system. Under the state's leadership, particularly the Healthcare Authority, we are now taking tangible, concrete steps to ensure that the proper incremental changes are being made in the ways we pay and reimburse healthcare providers. We all know that at least a significant portion of these payments need to be centered around rewarding quality health outcomes and in controlling the total cost of care. The groundwork being laid right now will serve as the precursor to the multi-payer strategies that we will need to develop to ensure that regardless of the payer or the purchaser, our systems are rewarding value rather than volume. If all the arms of the healthcare system can improve their coordination and collaboration, improved outcomes and decreased costs will occur. Providers of all types in our state know how to do the right thing. They know how to deliver great care, and they know they need to take into account social determinants of disease. The problem has not been the people in healthcare, but the systems surrounding us that we operate within. Until we take down the barriers that prevent the healthcare community from truly centering itself around whole person health and provide a financing structure that allows and supports the healthcare community to care for the community with the proper alignment of financing and reimbursement, we will continue to lament our frustrations, which we all do. Believe me, I hear it. Well, I'm here to tell you, in case anybody didn't know, that Washington State is on the path to making these innovative, necessary, and positive changes in healthcare. Our state has successfully and boldly, which not all states have done, embraced the Affordable Care Act, leaned in, and is making it work for Washington's many residents on many, many levels. A successful state health benefits exchange. Medicaid expansion, giving coverage to over 500,000 previously uninsured Washingtonians. A $1.5 billion 1115 waiver that will accelerate many of the positive modifications in the system we are discussing here today. Innovative changes in healthcare financing, behavioral health integration, with more of that to come. 9 accountable communities of health statewide, which have brought operational capacity building, identification of regional health priorities, and the implementation of projects that span both the life course and care continuum for residents throughout Washington state. Increasing engagement with tribal communities, many of which are already moving forward with these innovative ideas. When these accomplishments are viewed in their totality, it is clear that we are setting an example for other states across the nation, looking at pursuing these unique approaches to health systems transformation. It's not always pretty. By definition, innovation is disruption. Many of the leaders who will continue to take us forward here through these changes in healthcare in our state are in this room right now. And I am confident that through our collective leadership, we are already on the way to success. Those things that I observed 2 decades ago as a young physician are on their way to being improved and fixed. The train has left the station, and it's going down a very promising track, I say. With that, it is my sincere and great pleasure to introduce a gentleman that to many of us who have been in Washington for our entire lives really needs no introduction. Now, if I go through his whole resume, I'd be up here for another 15 minutes, so I will not do that. Mr. Ron Sims did serve for 12 years as the elected executive of Martin Luther King Jr. County, the 13th largest county in the nation with 1.8 million residents and 39 cities. As county executive, Ron was nationally recognized for his work on the integration of environmental, social equity, and public health policies that produced groundbreaking work on climate change, healthcare reform, affordable housing, mass transit, environmental protection, land use, and equity and social justice issues. Ron then served as the Deputy Secretary for the United States Department of Housing and Urban Development from 2009 to 2011. He was appointed by President Obama and unanimously confirmed by the U.S. Senate. As the second most senior official at HUD, Ron managed the day-to-day operations of an agency with 8,500 employees and an operating budget of nearly $40 billion. Ron is on the board of directors of the Washington Health Alliance and the board of regents of Washington State University. And if that all wasn't enough, Ron was appointed by Governor Jay Inslee as the chair of the Washington Health Benefit Exchange Board. So everyone, please join me in giving a warm welcome to a friend from Indiana.
It is great being here and talking to so many of you. You're all leaders, and so I am actually very nervous and quite intimidated by all of your expertise and your backgrounds and your experience. I've had several issues involving healthcare, and I smiled at them now, but they were very teaching moments. The first is when I was asked to, I remember sitting in the State Department process, they were advising us to what to do. We were in Zambia, the two of us were going to fly out by the Zambian-Angola border to monitor elections. And so you're asking a lot of questions. What can I expect? Who's going to tell me stuff? And the State Department said to us, there's one thing we want you to understand, and it's very important that you accept this. And I'm thinking, look, I'm already nervous. I saw the plane we're supposed to fly out there in, and it was not a comforting looking airplane. And he said, well, you should know that when, if anything happens to you out there, bleed out. I said, oh, really? Thank you. Absent health care, and if you got health care, it was better not to have it than to secure it. The other was when I was in Israel, and I had made a mistake of going down an escalator in thongs and bare feet. And all of a sudden I got down and my thong got caught up in the escalator, and so did a lot of my skin. And so I was, when I had to go to an Israeli clinic, and person is doing this fabulous job, and then we continued to talk, and he said, "Where are you from?" And I said, "From Seattle." He said, "I went to University of Washington Medical School." So he goes on and on and on. He said, "I also did my internship at Harborview. You know where that is?" I said, "Oh yes, we talked about Harborview." And then I said to him, thinking, this is going to be really expensive. So then I said, "Okay, how do I pay?" And he said, "We don't charge for health care in Israel." And I said, "Oh, so those two, bleeding out or having all your health care paid for, were reminders to me that we're in a world where we have that separation. And we keep today believing that things have changed, and they have changed significantly. Now we have people who can get insurance and who need to be insured. And I then reflect back on my early childhood when I remember my parents going to the grocery store, and then my oldest brother, James, all of a sudden having an asthma attack. And then he started saying goodbye. And nothing hits you harder than have your oldest brother say, "I love you," and goodbye. And I remember calling the ambulance, and they came, and they picked him up, and my parents said, I said, Mom, and Daddy, James got sick. They take him to the hospital. And then 3 weeks later, I was at the train station waving at my brother goodbye, because the National Jewish Hospital had decided that he should be their patient, and he was there for 2.5 years. But he came back, and they added another 56 years to his life. The value of healthcare hit me so hard, to be able to realize that here is a doctor who made a decision that my brother could not be helped here, but he needed specialty care, and my parents could not afford it, and yet there was a place for him to go. But much has changed from those days, and I want to applaud all of you for that. But there's other things that I also want to talk about, and it is the time that I asked one of the county planners, actually to 3 of them. One was in land use, one was in transportation, and the other one was healthcare. And the idea is that we are working with the University of British Columbia on how do you merge those? You know, how do you have a healthy community? And our issue is really simple. Can we predict who's going to get a heart attack by the length of their commute? This, you know, it was even intriguing to me because I wanted to make sure that my 15-minute commute from my home to work was not going to be materially impactful. And so they met, and they met for 3 months, and they had not arrived at a conclusion yet. And in fact, they had not arrived at a common language set yet. And then after 6 months, they were still trying to arrive at a common language set. So I was asked to come in a second time and talk to them. And I said, future employment depends on you arriving at a common language set. All of us have perfected silos, and we work really well within them. There are comfort zones. We love staying in our silos. It's getting outside of those silos that we have, that has a material impact. That's where the difference is. And they came out with a study that basically said that if you commute more than 1 hour to work, the likelihood of a heart attack at 72 years of age is really high. If you commute 1 hour to work and 1 hour back. And I will never forget that data, saying that it would affect our growth management plan so that we would be able to try to constrain people so they were not those 1 hour commutes to and from work every day. But we are still in those silos. And it is time, and I think all of you are here, recognize the fact that there is no single solution to healthcare anymore. It does not exist. If you think that it does not exist. The issue is how can we see the wholeness and begin to be far more collaborative in how we're approaching this. When King County did a study that allowed us what we call social determinants, I remember going back to Washington, D.C., the Joint Center, which was an African-American think tank, was having a press conference. I told my 2 sons who were in high school, go to the press conference and bring back all the paper that they have, but only 1 copy. Only 1 copy. So we brought back 3 boxes. But the study basically said that African-American males It said 36% of African American males under the age of 30 would have nothing in common with the rest of America except their debt. So I gave it to a staffer named Chandler Felt. I said, Chandler, is that a problem here? Now I was never the smartest kid in class. The troublemaker, yes, but never the smartest one. And I learned as county executive to let smart people do what smart people do, which is to bring their issues forward. So you trusted their approach. So after 2 months, I said, Chandler, where are we at? He said, we're working on it. So, okay. And I went back to my seat in my office trying to be county executive. Then a little later, I went back and said, Chandler, how are we doing? He says, we're doing really well. We're getting there. But no definitive answer as to timelines or when I would get things. And so finally, I went to Chandler and said, you know, I'm not going to beg. It's one that could feel. And he said, we're really close. And when they came out with their report that was really close, report was devastating to me personally as an executive and should have alarmed everybody. The report said simply that we can predict by zip code life outcomes by children, what you're going to die of, what your illness is going to be, who has medical care, are you going to get a pill in one zip code or a surgery in another, or something like diabetes. All of a sudden the disparities just screamed out that zip codes were life determinant. I never forgot that. That has not changed in the world today. That has not changed. Zip codes still have a profound impact on lives of people because we have not embraced the change necessary so that every community is a healthy one. That we haven't provided opportunities for and to say, okay, everybody's going to be treated, that isn't true either, because if you're in 98118, which is 5 blocks from my house, and you have diabetes, you're likely to end up with surgical intervention. But if you're 98144 where I am, you're going to get a pill. The differences in practices and our approaches have changed. So what I want to say is, if you're going to meet and you really want to be the very best, and who wants to be second? I mean, who wants to run and say, I worked really hard to be in second place? Now, I always tell people who are in second place, it's okay, you tried hard. No, it's really great. When the Seahawks won the Super Bowl, we didn't say, yes, yeah, you know, second was good enough too. We didn't say that at all. When the Sonics got the NBA championship, we didn't say to them, oh, wow, the Sonics, you could have been second. We would have been happy. No, we're not. All of us strive to be very good at what we want. It is a statement as to excellence and work and attitude. So I don't know why any of us in this room would want Washington State to be second to anybody. Why would we accept that? Or any community in it, and we're diverse. We have the agricultural sectors, rural areas, urban areas, Native American tribes. We have the complexity of this country in this state. And I think within this room is the skill set of people to merge all of those things that would create the healthiest population in this country and use tools that are both within our control, but also tools that we can express to others that would allow us to have healthy children, allow us to have healthy populations, a well-aging population, and as we would have the best healthcare system, not just talking about hospitals and doctors. I respect hospitals and doctors. Not just talking about land use planners and healthcare planners, but talking about the entire complexity of what constitutes health care. We have a very narrow definition, and we're comfortable with it. Each of us says, oh, I do health stuff, or I'm in healthcare. That's because I work for a doctor. But I always say dentistry is really important. And we now realize that we have kids and say, well, I remember the data we got from the dental groups out of the county putting out that if you are subsidized lunch, you're likely to have 8 active decaying teeth by the time you are in 3rd grade. Not 2, but 8. I'll never forget that. And I said, that's seemingly so wrong. You cannot learn with decaying teeth. When I was a kid, you got visual exams. So I tutored in the Seattle school system for 7 years, and kids would say, I can't read. And people said, okay, they give them a different reading book. No, the kid couldn't read because the kid couldn't see. So we used to do visual exams, now we have set that aside. We have siloed all of these different things. Behavioral health. We assume that you have to be a certain age to be determined that you are having huge mental health challenges. No, it shows up early, and yet we have somehow or other put behavioral health over here, physical health over here, our land use decisions over here, our healthcare zip code decisions over here, and not united them. So I think it's time to have a common language, because that's what force is. Teams are built when a play is called, but everybody knows their role in it, and their role is to make sure that everybody achieves. I was never a lineman, although I looked like one. And I should have turned my phone off. I don't know what age. I used to turn it off. Now I forget to do that. Actually, I'm retired, so I'm not used to these calls. But anyway, when you're on a team, everybody has a role, and the role is basically to have everybody achieve, do their job. I was coaching football, and I remember the team crying. I remember going out in the field. They were crying. They just cried. Kids would cry. We'll lose, coach. I said, okay. I said to my son, you know, I haven't called a pass play, and you've run about 8 of them. So I said, I want you to just hand the ball off to a running back. And so my son said to me, okay. I said to the center, I want you to hike the ball on the first hut, not on a good vibe hut. Not 3, not 4, not, sing as we're hunting. There's going to be one hut, and you are going to hike that ball. Then I turned to the running back and says, no, the 33's been open all day. I've called the 33, you run to the 34, you run everything but the play I called. Does anybody want to run the 33? So this guy Fred says, I'll do it, Mr. Sims, I'll do it, Mr. Sims. Okay, I said to my son, we're running the 33, first hut. Then I said to the lineman, does anybody want to block? When people run past you, you don't want to say thank you very much. You really want to knock them down. It's okay. And so Brian said to me, Coach, I would do that. I said, okay, Brian, you're over the 3-hole. So we called it. My son got the ball on the first hut. He actually ran the play I called. He gave it to Fred, the running back, a beautiful running back. And Brian hit everything down the field. Other players, the referees, the parents. We scored and won the championship game. A team. So I want to say that I would hope that you would understand the importance not of how important you are alone, but how great you are when you have gotten out of those silos. That I'm the totality of a person. I'm not one piece, I'm not one review, I'm the totality. We have a lot of people in our communities who have a variety of problems, and we assume that they know where to go. No, they don't. We assume that other systems. This week I was talking to landscape architects, saying to them, if you just do something really simple, like urge cities to actually begin to think about vegetation and trees in communities that have low outcomes on healthcare, do you realize that epigenetically you'll alter those communities? And he said, what is epigenetics? And I said, our genes are elastic. They run all over the place. And what happens is if you get a signal of fear, you stay in fear. So we spent billions of dollars in poor neighborhoods and didn't realize that cortisol in your system, which is created by your genes saying that you should fear, is an inhibitor to learning. We spent billions of dollars. And then we blame the kids and their parents. No, the built environment was far more significant an influence. So I guess I'm at an age now where I'm retired. I'm trying to tell people, get your act together, please. That you can no longer talk about who's insured. No, talk about who's insured, what does it cover, what are the responsibilities of cities and planners and land use and vegetation and parks. Merge it, and merge it with a strong voice. It's not being done anywhere in this country. Everybody is very comfortable not talking to somebody, being an expert in my field. But no, I want us to be an expert in all things. I want us to change the paradigm in which we look at healthcare. We tend to talk about what do people need when they go to the doc? What do they need when they go to the hospital? What do they need to go to the clinic? No, I don't want them to have to go to all those places. I want to make sure that we have them healthy. If I go to a doctor, it's my checkup. I want to know that I can be in a neighborhood where I'm not in fear. As the Seattle Times reported kids in Rainier Beach, when the kids said, what do you fear? I fear being at the bus stop. I fear being at a bus stop? It is so wrong as an indictment. And everybody got comfortable with it. I remember looking at some of the people saying, well, wait at the bus stop. How can a kid say, when they say, I fear being at a bus stop, they're crying out for help. So I want us to listen. I want you to mobilize. We have all of the ability to do that. We have great people who are elected who understand that issue. Unbelievable practitioners in this region. If you're going to get sick in the state of Washington. I don't care at what level. The practitioners are great. The plans have done their job. What I'm asking now for is a wonderful stew. A wonderful blended stew. When my mother, who sometimes you get there's a time in your life where you're talking to my mom. I always talk to my mom. I always wanted to say to her, I wanted her to tell me that I was okay. Mom, am I doing okay? Oh, yes, honey. I knew she was going, the kid is crazy as heck. But I went to my mom and we were talking. And I remember what I was told to tell her. It was by my doctor, her doctor, and a chaplain. And it was really simple. He said, I've watched you all these years, and there's something your mother has to know, and this is what you have to say. So she was laying in the bed, and I said, Mom, Donnie and James are in heaven with Daddy, but they wanted you to know how much they loved you, and I'll be okay. And she had this puzzled look, and then I said it a second time. Same words. And then I said it to her a third time. And she had the most beautiful smile on her face. And 20 minutes later, she was gone. Her job was done. She was an incredible mother. I now know what a beautiful, wonderful mother is. How they are, you never make a mistake, they just kind of correct your behavior. You're perfect and they handle your imperfections very well. They stand behind you through thick and thin. They push, love, and hug you. But her job was done. So I would tell everybody in this room that you've been given one more day by a higher authority than anybody in this room. One more day, one more week, one more month, one more year, and a career. What an endorsement as to you and your talent. But it doesn't mean that we will ever settle for second place. It means when people talk about healthcare, wherever they talk about it in the world, they'll say, wow, in Washington State, wow, wow. Peace be with you.